Chapter 7, Care of Patients with Pain. When a large volume of non-painful stimuli is competing for the gate in the gate control theory, the pain impulses may be blocked. A high volume of pain can override other stimuli and pass through the pain gate, causing the individual to perceive pain. Massage and vibration can produce activity in the large diameter nerve fibers to assist with pain. The more painful the stimuli, then there is greater pain, and it will take an increased amount of treatment, whether it's non-medicational or medicational, to control that pain. The human body produces endorphins, which are endogenous opiates that will attach to the opiate receptor sites and help block the painful sensation. But it isn't clear how the endorphins work. They appear to modify and inhibit any unpleasant, painful stimuli, reduce the amount of anxiety, and relieve pain. The endorphins may produce a feeling of euphoria and a feeling of well-being. There are various aspects of neuropathic pain that relate to the nursing practice. We understand as nurses that analgesics and opioids usually do not relieve any neuropathic pain. There are additional medications like NSAIDs, tricyclic antidepressants, anticonvulsives, and steroids or corticosteroids that assist in relieving neuropathic or nerve pain. There are differences in acute pain compared to chronic pain. Acute pain, their duration is roughly hours to days. It has a good prognosis for relief, and it may resolve spontaneously or in response to analgesic therapy. It's usually easy to identify the cause of the pain, and routinely there's no psychosocial effects or may alter normal activities or routine temporarily. Medication is routinely beneficial with acute pain, and surgery can be seen as helpful depending on the situation. For chronic pain, it lasts for months to years. There is a poor prognosis for relief unless anything that's complicating the pain is removed. Then they may have spontaneous pain relief, but it is routinely unusual that they receive pain relief. Sometimes the cause can be known and visualized, but the diagnosis is often complex or undetermined. There are psychosocial effects because it can affect an individual's ability to earn a living, enjoy social activities, and maintain self-esteem. Medications can be effective and helpful, but because of the type of medication, the patient may become dependent. Oftentimes, there may be multiple medications that are used. Surgery could be of some assistance, but it can also actually make the problem worse. Pain is subjective. It is what the patient states it is. Only the individual that has the pain knows the location, the intensity of the pain, and which therapy or treatment works and how long the treatment or therapy is effective. This is why pain is included in vital signs, and this is why we know as nurses that the patient must be asked about their pain status. An individual's perception of pain relates to the individual's pain receptors and the gate control pain theory. If they are unable to use the endorphins that are produced and the pain gate stays open, they're going to have a lot of pain. Sometimes we know that by having the patient relax and use some sort of distraction, this can help or alter their perception of the pain that they are experiencing. When a nurse comes from a cultural background that approves the stiff upper lip approach to handling pain, they may be biased against an individual who outwardly expresses their pain. The nurse may unintentionally see this patient as being weak or being manipulative. But in contrast, if the nurse comes from a different culture and the individuals have been in pain routinely and it has been expressed, the nurse will have a different outlook or feelings related to the patient that is expressing their pain. We as nurses realize that we don't want our patients to try to hide or deny the pain. If we can help by intervening and understanding that the analgesic therapy can help actually aid in the healing process. For any individual to cope with any pain takes energy. And patients that are already debilitated, thinking about a cancer patient, for example, they are less able to understand and manage the pain than the people are that have healthy energy levels. Fatigue that is caused by pain can increase the individual's pain perception. Pain is a stressor to the body, and it takes energy to manage pain. For specific reasons, chronic pain is often associated with depression and fatigue because it is such a stressor to the body. Routinely, we can identify the cause of acute pain, and acute pain, the prognosis for pain relief is really good. For chronic pain, the cause may be known, but often it can be due to some other undetermined or complex disorder. And oftentimes chronic pain, the prognosis is not as good. People don't seem to get continuous relief whenever they have chronic pain. Between 60% and 75% of older adults have chronic pain. The most common conditions that cause pain in older adults are joint issues from osteoarthritis, degenerative disc disease, osteoporosis, low back pain, and pain from previous fracture sites. Pain may be combined with other chronic diseases, and this would cause a sort of debilitation. If chronic pain is adequately controlled, the quality of life may be improved. The Baker-Faces pain rating scale. As you can look at the faces, for coding purposes, there's numbered 0 to 10. The face, legs, activity, crying, consolability, or the FLAC scale, this is used to assess pain in cognitively impaired individuals. Cultural beliefs affect the pain perception as well as treatment. In European white individuals, men display strong stoicism. Their narcotic use brings fear of addiction for many individuals. They may dismiss the effects of pain and continue to work and carry out usual activities. They often prefer to use non-narcotic medicines. Many prefer to use relaxation and distraction rather than just medication or try to tough it out. Hispanic Mexican Americans. They often believe that pain is God's will, and these are stoic individuals. Pain can be seen as a consequence of immoral behavior. For some men, expressing pain shows weakness and may be seen as a lack of respect. Some of these individuals believe that injectable medication is better treatment for pain than a pill. They believe that prayer, heat, and herbs may be used to treat pain. African American and African Native peoples, for them, pain is often seen as a sign of sickness. They may express pain openly, but this varies from individual to individual. Pain may be seen as something just to be endured. These individuals may rely on spiritual or religious beliefs to help them endure pain. For Asian individuals, various among different subcultural groups, but these individuals tend to be stoic. Bearing pain is seen as a matter of family honor, and it may be described obliquely in terms of body systems. Older adults often will fear addiction to pain medication. American Indian or the Native Americans. Many believe that pain is something to be endured and will not ask for pain medicine. Pain is described in general terms such as, I don't feel good. Many of them will use traditional medicine men and rely on herbal preparations. In determining the patient's perception of pain, which question would be useful in assessing pain? Where are you hurting? What pain control measures have worked for you in the past? How would you describe your pain? What were you doing before the onset of pain? Did another person witness your pain? The correct answer is 1, 2, 3, and 4. There are terms that are used frequently to help individuals describe pain. When you think of the degree of pain, or from least severe to most severe, terms may be absent, minimal, mild, moderate, severe, excruciating. For quality of pain, words that may be used are crushing, tingling, itching, throbbing, pulsating, pulling, searing, stabbing, blinding, nauseating. For frequency of pain, terms may be constant, intermittent, occasional. Prior to administering any medications, the nurse needs to understand the medication that the patient is receiving. The nurse should know the adverse effects and the side effects. Oftentimes, nurses will use the PQRST acronym for pain. P stands for palliative or precipitating factors. Q is for quality. R is for region or radiation of pain. S is for subjective description of pain. T is for the time that the pain occurs. Managing pain is often a combination of medication and non-medical therapies. Non-medical therapies, think of hot, cold, positioning. Non-opioid analgesics, including the NSAIDs or non-steroidal anti-inflammatory drugs. These block pain at the peripheral nervous system level because they decrease inflammation. Think of aspirin, acetaminophen, ibuprofen, naproxen. Other NSAIDs are available as topical creams, gels, solutions, sprays. The patients should be educated not to use these in a combination with other over-the-counter dosages of the same medication. Some of these medications will have an antiplatelet action and can increase the risk of bleeding. Opioids block pain at the central nervous system. Morphine, meperidone, hydrocodone, codeine, fentanyl, tramadol. Methadone is also available but isn't routine for pain control. With these medicines, constipation is quite common and can be extremely severe. These medicines also can cause respiratory distress. The antidote for the medications are naloxone. There are medications that have non-analgesic primary actions that are used in adjuncts to pain control. Some of these would be antidepressants, anticonvulsants, stimulants, some muscle relaxants, and some chemotherapeutic agents. These are different medications that can be used for pain control. As nurses, we need to make sure that we understand the side effects related to the medication that the patient is receiving. Constipation is caused by opioid medications. Morphine, meperidone, codeine, these all slow peristalsis. Oral fluids need to be increased. Stool softeners and fiber-based laxatives need to be provided or at least available. Miralax is also effective for opioid-induced constipation. These types of medications will also cause drowsiness. Allergic reactions, if they begin, they need to be reported and the medication should be discontinued. An antihistamine like diphenhydramine may be given for itching. These medications cause respiratory depression. Individuals will need resuscitated immediately. They will need respiratory support. Naloxone should be on hand if these narcotic agents are being used. Individuals can become addicted to narcotics. Patients in pain have the right to expect that the analgesia will be available to them. Dependence does occur with long-term use of narcotics, and they should not be abruptly ended. When pain can be controlled with non-narcotics, the patient is tapered off the narcotic medication. For end of life, the nurse needs to make sure that the older individual does not have bouts of constipation when they're receiving opioid analgesics. The nurse will encourage the increased intake of fiber and fluids, administer a stool softener suggest prunes, monitor for bloating, discomfort, and daily bowel movements. Rest actually increases pain tolerance and improves response to analgesia. Heat promotes vasodilation to the area. This will increase the blood supply and movement of nutrients to the affected area. Mentholated products are usually massaged into the skin. It has the benefits of massage and warmth. Cold decreases metabolic rate and nerve conduction. This will decrease pain sensations. A transcutaneous electrical nerve stimulator, or a TENS unit, is a small electrical stimulator that is attached to the skin, and the electrodes are placed around the area of pain. A spinal cord stimulator can be implanted under one's skin with the wire placed in an epidural space right adjacent to the nerves that innervate the affected body area. Epidural injections may also be used to ease nerve pain. Alternative and complementary therapies would be heat, cold, positioning, sometimes biofeedback, relaxation techniques, acupuncture. Which statement by a nurse promotes the use of massage in reducing pain? Family members can perform it safely and effectively. It stimulates the circulation in reddened areas. It relaxes the muscles. It increases the general sense of well-being. It uses short, mild strokes. The answer is 1, 3, 4. Adjuncts to pain management like simple massage, relaxation, use of pillows, warmth, repositioning, or soft music are taught to patients and family for use in a home setting. The current guidelines for home care by agencies like Medicare require that case management be done by a licensed professional. This is routinely a registered nurse. The role of the LPN and licensed vocational nurse is that of direct patient care under the guidance of the case manager. The LPN or LVN may monitor an ongoing infusion and discontinue the infusion as needed, but must report any difficulties immediately to the case manager for interventions. Some states offer IV therapy certification for LPNs and LVNs, which does allow them to infuse medications.